Right, we can start. It's 12:30. Okay, welcome everyone and good afternoon. Thank you for joining us today on your lunch hour, and thank you also for the overwhelming response to our parenting webinars. This one in particular has been very well subscribed. I'm Bipasha from the EtonHouse brand and communications team, and I will be your co-host for this afternoon session. The dialogue today will focus on stress and mental health and supporting well-being in children. This has been a focus for us at EtonHouse, more so in the last year with the pandemic upending our lives and that of our children. Recent incidents have also trained the spotlight on this very important aspect of development in young children and youth. I'm joined today by my co-host Nysa Kaprani, a student at EtonHouse Orchard, and our speaker for the day is Dr. Gina Dahel, head of department at the International Medical Clinic's Children's Department, where she manages newborns to older adolescents. Dr. Dahel graduated from the University of Birmingham Medical School in the UK. She completed her pediatric training in the UK with 2 years in Singapore. Dr. Dahel also received her fellowship of the Royal College of Pediatrics and Child Health in 2020. Welcome, Dr. Gina, and thank you so much for joining us today. Before we begin, a few housekeeping rules. Please drop your questions in the chat. For those of you who have already sent us your questions, thank you ever so much for doing so. We will be addressing them in the course of the sharing today and also during the Q&A session in the end. Your camera and mics have been turned off, so you don't have to worry and can relax and enjoy the talk. Right, so let's dive straight in. Nysa, welcome to the webinar and thank you for co-hosting the session with me today. She's the youngest host we've ever had at 12, almost 13. Nysa is wonderfully mature and has a lot to share with us today. Nysa, over to you.
Thank you, Vipasha. Hello, everybody. My name is Nysa Kaprani. I am 12 years old and I'm in year 8 studying at EtonHouse Orchard. I am extremely happy to be a student moderator for this webinar and to hear more about mental health and stress from Dr. Gina. I strongly do believe that students of all ages undergo different kinds of mental stress without having much knowledge of how to deal with it. So I really hope that after watching this webinar, all you viewers, both parents and students, will be able to identify and learn how to deal with stress.
Dr. Gina, would you like to say a few words?
Yes, so thank you. Thank you for inviting me today to give this really important topic, and thank you for the warm welcome. As a paediatrician, I'm definitely seeing more and more kids presenting to clinic with symptoms of stress and also mental illness as well. And exactly as you said, COVID really has impacted all of us. But I think here in Singapore, for our kids especially, it's really turned their lives upside down. There's been the issues of not being able to see extended family. They've been quite isolated from their friends because of all of the restrictions. They've all had to deal with the challenges of home learning. And for some of the younger kids, they're still too young to understand exactly what's going on. So I think this is a really relevant and key topic that we're talking about today. So when we think about health, I think we instinctively think about physical health, but actually mental health is just as important as physical health, and you can't have one without the other. So if you've got poor physical health, that's going to impact your mental health. And if you've got poor mental health, it's going to impact your physical health. So mental health in kids is really how kids feel and think about themselves and the world around them. And it's important because we know that childhood is an important time for them to develop those positive emotional and behavioral building blocks, which are going to help them later on in life. If they develop a positive mindset, that's really going to help them to cope with stresses or challenges in life, whatever they may be. But if they develop a negative mindset, they're really going to struggle their whole life. And we know that if they do develop that kind of negative mindset, then it can put them at increased risk of developing mental health issues when they're older. And it can also impact their physical health as well. So mental health is really important in children, but it's also something that we do see quite frequently. So for the age group of 2 to 6, 1 in 6 children will have a mental health illness. And that's actually quite a lot. So if you think about a class with 30 kids in, that's about 5 of them that may have an issue. And mental health issues like stress and other ones as well, it doesn't just affect the child, it affects the whole family. It will affect siblings, it will affect the parents. So it really is an important topic for all families.
Thank you for that introduction. It's true, in fact, we were discussing the other day that the children who are joining our schools at the moment are those that were born in the post-COVID era, and they have always seen masks on when it comes to adults, so they think that's probably how it's always going to be. So and also it's interesting that you mentioned that children as young as 2 can also have issues with mental health and stress. So that's something that it's good for our parents and children to know, and also how do we address this going forward. So the first question, therefore, to Dr. Gina is, what are the signs of stress? You mentioned stress in young children, and how can parents identify them?
Okay, so everyone has stress. Even young babies can have stress, and it's a normal part of life. And the definition of stress is emotional or physical distress and the feeling that you can't cope with a stressor. Now, that can be an internal stressor coming from within you, or it can be an external stressor. Now, stress is important. It helps us to get things done. If we don't have any stress in our lives, we have no motivation to complete anything. So you do need a little bit of stress. And as your stress levels start to increase, then that increases your focus, your determination, your activity, and actually your performance increases. So for kids, if they didn't have a little bit of stress, they wouldn't revise for an exam or practice the piano, those sorts of things. But the issue becomes, if the level of stress continues to increase, it reaches a threshold, and you then move from this level of being stressed to this level of being distressed. And at that point, as stress levels increase, it actually reduces your focus, it reduces your attention, and it reduces your performance. And this is what we call toxic stress. And as this continues to increase, that can actually have a really negative impact on your mental health and also on your physical health. So when we're talking about stress in children, we're actually talking about toxic stress, because good stress actually is important for all of us. But we're really looking at those situations where the stress is too much and the child can't cope. Now, as adults, we're actually not very good at knowing ourselves when we need help. And children, just, they're even worse than adults. Very few children will come up to us and say, I'm feeling stressed. Yeah, things are too much, I can't cope. So it really is up to us as parents to really pay attention and try and pick up on subtle cues. So in terms of stress, it can manifest in a number of ways. It can manifest in their behavior. So there may be a change in their behavior, and it really depends on the age of the child. So for younger kids, you might notice that there's a regression in their behavior. They may become more childlike. You might notice that they're starting to have more separation anxiety. They're starting to get more clingy again. They might be having nightmares. For older kids, teenagers, you might notice that they start acting out, they're breaking boundaries, they're pushing boundaries, they're breaking rules, they're becoming more aggressive, that sort of change in behavior. So it can manifest in their behavior. It can also manifest physically as well. So this would be something like a change in their eating habits. They're eating too much, or they're not eating enough because they just don't feel hungry. They may be sleeping too much, they may be sleeping too little, they're just not able to get to sleep because they're worried about everything. And something that we see very commonly in pediatrics is something called somatization. And this is actually the physical manifestation of stress. So a lot of the times we'll have kids coming into us with chronic symptoms of tummy pain, headaches, those sorts of things. But actually there's not a physical cause. It's actually that they're stressed or they're anxious or there's something else going on. And their symptoms won't get better until that's addressed. So that's how it can affect their behavior, how it can affect them from a physical point of view, but it can also affect their school performance and their social relationships as well. So if you notice that your child is suddenly not focusing at school, their grades may have dropped, they may not want to go to school, suddenly they don't want to hang out with their friends anymore, they don't want to do all of those extracurricular activities that they've always loved doing. So it can manifest in a variety of ways, but definitely as parents, we do need to keep our eyes open, because like I said, it's really unlikely that your child will come up to you and say, I'm not coping. It will manifest through their behavior or physically or how they're interacting with people.
Thank you for sharing. That's really useful for us as parents to, look out for that. And you're absolutely right. We know our children best, so it's for us to really pick up those signs. And it's interesting that you talked about positive stress, because Nysa and I were talking just before we started about how she uses stress in a positive way for exam prep. So, Nysa, the next question is for you. Would you like to share your thoughts on what causes stress in children?
Thank you, Vipasha. And so I personally believe that there are different forms of stress that can easily get to children, such as being under peer pressure, the stress of submitting an assignment, or maybe even the stress of having to organize themselves to do multiple tasks on a daily basis. And I also feel that each child can have a different reaction to the stress, which could be taken in a negative or even a positive manner. So, Dr. Gina, if you could please share what the effects of stress are on children.
Yeah, so your point is exactly true, Nice. So there's different types of stress, as I said. So there's good stress, and then there's that toxic stress. And you obviously have a very positive mindset, so you're able to cope with stress really well. But yeah, going back to your question, so the effects of stress. So I've already spoken about how it can affect them physically, in terms of changes in their sleeping pattern, in their diet. There may be somatization. It can affect their behavior depending on the age of the child, and it can affect their interactions at school and also their relationships. But it can also increase their risk of mental health illnesses. And this is a really important one because we know that having a mental health disorder in childhood is associated with lots of negative outcomes. So we know that if you do have a mental health disorder when you're quite young, then it can affect your school performance. You're less likely to graduate school. You're less likely to go to university or college. You're less likely to have a high earning job when you leave. You're less likely to have a good wage. And it also increases your risk of taking part in risky behavior, so things like drug and alcohol use as well. So it does significantly increase your risk for that. And it also does increase your risk of getting in trouble with the law and being in prison as well. So mental health in childhood is really important because it doesn't just affect the child whilst they're young. It can actually have a long-term impact, and it can actually have a lifelong impact. So other than that, it also really does have an impact on the family as well. As I said, it's never about the child in isolation. It would always have a ripple effect for the whole family as well, so other siblings and parents as well. So a really, really important thing to pick up for sure.
Thank you for that, Dr. Gina. So my next question is, once we identify that this is a stressful situation that's tending to be toxic for the children, how do we then seek professional help? And could you also share what sort of professional help you recommend for families? And do you suggest seeing a doctor first or a psychiatrist?
Okay, so with stress, as I said, because you can have normal levels of stress, we really need to define when it's just normal stress and when it becomes toxic stress. And the defining point really is when it's affecting your quality of life, it's affecting your day-to-day functioning. So to the point where you're not able to go to school, it's affecting your school performance, your grades are really starting to drop, it's affecting family relationships. Families don't want to go on days out, they don't want to take out the kids because they don't know how they're going to react, how they're going to respond. When it's interfering with relationships with other people as well. So maybe you've isolated yourself from your friends, friends don't want to play with you anymore because of your behavior. So we really want to look out for that defining point where it's really impacting the day-to-day life. And early intervention is really important, as I said before. Identifying that your child needs help and getting that help early really is key and paramount. If we manage to get kids when they're still quite young, we can change their mindsets. We can implement those coping strategies. We can provide them with tools to really change the way that they think about things, so that they can cope with things later on in life, because they're always going to be exposed to stressors. That's part of life, but it's how we respond and how we react to those stressors that makes the big difference. A lot of time in medicine, families come to us and they've already reached crisis point, and that can be quite difficult. We want to try and get them to come in earlier if they can. And I think one of the reasons why families do present so late is that there's still quite a lot of stigma about mental health illness. And really, in today's day and age, they shouldn't be. You know, mental health is just as important as physical health, as I've said, and we wouldn't wait and wait and wait if we had something physically wrong with us. And it's the same for mental health as well. So it's always worth speaking out early if you have any concerns, just so we can get the ball rolling. In terms of the best starting point, I do think that a paediatrician, so a specialist in child health, is the best person to go to first, because we want to look at the global health of the child. We don't just want to narrow down on their mental health. Physical health and mental health are related, and they do go hand in hand. So generally we would do a full physical examination, and there might be some investigations like blood tests, and maybe some imaging. And occasionally we do see physical or organic causes for mental health symptoms. So there may be an underlying endocrine problem or something like that. Very often change in personality is actually because there's a brain tumor. So it does present sometimes with mental health symptoms, but actually it is a medical cause for that. So it's important to rule that out. Also, as paediatricians, as doctors, we can support the child, but not just the child, the family as well. Yeah. So it's the whole family that needs the support. It's the whole family that needs to be taken care of as well. There'll obviously be some sort of mental health evaluation depending on what the issue is, and also an assessment of risk. Back in the UK, I used to see a lot of children at crisis points, and sometimes they were so sick or they were a risk to themselves or a risk to other people that actually we couldn't have them go home, and we had to get them admitted to hospital and take care of some of their physical needs first before we could work on their kind of mental health needs. And then the final thing really would be the treatment plan once we've gone through all of that. And the treatment plan, of course, really depends on what the underlying issue is and actually what the mental health concerns are. And it may involve therapy, it may involve discussions with a psychologist or a psychiatrist or counselling. There may be sorts of therapy like cognitive behavioural therapy, and there may be pharmaceutical medical management as well. But the important thing about the treatment plan is that everybody has to be on board, you know, the child, the family, and the people taking care of the child as well. If everyone's not on board, if everyone's not engaged, then it absolutely will not work. So that would be a good starting point for sure.
Thank you, Dr. Gina. And I completely agree with those points that you've just shared. And I also have a personal experience as well. So as we all probably know that children can easily get overwhelmed with life changes, such as birth of a sibling, loss of family member, or even moving to another location, which is quite common in Singapore due to our diverse community here. And I can even relate to this. So moving to Singapore was a big change for me. But because most of my family actually live in my home country, India. And with the access to technology these days, I can contact them easily. I can talk to them online whenever I want. But as much as I enjoy doing that, it is much more joyous to see them in person. But Dr. Gina, what do you suggest are ways in which children can cope with these changes, and what role do adults play in this?
Okay, so that's a great question. So there are lots of things that we can do to help our children cope with stress. So one of the most important things is making sure that your child is as physically healthy as possible. So just like as I said before, physical health is just as important as mental health as well. So things like exercise, you know, are they meeting the minimum requirement, which is about 60 minutes of physical activity a day? And we know that exercise is really important because actually you release a lot of endorphins, which are feel-good hormones, and that can lift your mood. Making sure that they have a good, healthy diet, which can be a little bit tricky sometimes for kids because we do see a lot of fussy eating. But nutrition is really important, not just to the body and the muscles and the bones because it's growing, but actually to the brain. It's really important that the brain has all of the nutritional needs, all of its nutritional needs are met, because the brain grows so much during childhood and adolescence. And there's lots of work being done on how what you eat and your gut health, how that's related to your brain performance as well. So making sure that they're exercising, making sure that their diet is really good is important. Making sure they're getting time outdoors. That has been a little bit tricky with COVID and having with all of the restrictions, but being outside actually does release oxytocin. Oxytocin is an anti-stress hormone and it helps combat stress. So having lots of time outside is really key as well. Sleeping, this is something that's often overlooked, but sleeping is so important, especially when you're a child, especially during the teenage years. If you're not getting enough sleep, that's going to have an impact on your mental health and your physical health. So making sure that all of that is as good as it can be. So those are things that we can do as parents to make sure that our children are physically healthy. And we as parents can also help through a variety of things. So the first one is modeling good behavior. So as parents, we actually have the biggest impact on our child's future success and well-being. So it's not what school they go to, it's not, you know, how much money you have, it's none of that. It's actually how you're parented. And how we cope with stress, that will actually be the blueprint for how our children cope with stress. So I often do recommend to parents just to take a little bit of time to reflect on your own coping strategies and making sure that they're as good as possible. If you do reflect on your coping strategies and they are negative, then it's time to kind of change that because that's actually demonstrating to your child how they should be coping with things as well. If you've got really positive coping strategies, then awesome, that's amazing, keep going. But yeah, it's really important that we do model good behavior to our kids. It's also important that as parents, we make time for our children. And it's not a case of just being there, but actually being present and actually being engaged with your child. And it's not possible, you know, parents, we are busy, we have got jobs, we have got, you know, 100,000 other things that we need to do. And it's not quantity, it's that kind of quality time that you're spending with your child. So do try and make time each day, even if it's not every day, at least a few times a week where you're just engaging with your child one-on-one. If you've got more than one child, then you'll have to set other times for them as well. And where you haven't got any screens, you haven't got any distractions, you're not on your mobile, you're fully committed to your child. And that's really important for them as well. The other thing is having a positive approach to discipline. That can be quite a difficult thing, but we know that being overly harsh or having quite a negative view to discipline can be harmful to the child. Yeah, so if you're too much into discipline, that's not going to let your child grow, and that can actually have an impact on their mental health and physical health. There's lots of studies which show that. But also if you're too extreme and you go the other way and you let your child do whatever they want and you don't have any boundaries, that's also associated with poor physical health and poor mental health. So it's good to strike a good balance there. And just having really kind of open communication with your child. You know, your child should feel like you as their parent is their safe space, that they can come up to you with anything and discuss it with you without any fear of there being repercussions. Yeah. And if they feel like that, then that's really going to help them develop that kind of positive mindset to help them cope with stress as they get older. So all of those things can help, and all of those things can make a really big impact. So that's keeping them physically healthy, how parents can help, but also there are things that children can do themselves. So positive actions, things like meditation, things like yoga. If you're one of those people that like to write down how you're feeling, that can be very therapeutic as well. Lots of mindfulness apps. So again, lots and lots of evidence which shows that these things can make a big improvement to how you're feeling, and some of them can increase oxytocin, which, as I said, is that kind of anti-stress hormone and can combat the negative impacts of stress. And then also support. This is a really important one. support from everywhere. So support from your family, having support from your friends, and having support at school. Yeah, kids spend a lot of time at school. So, I think these sorts of parenting webinars that EtonHouse is doing is amazing, because it shows that actually from a holistic point of view, you do care about the general well-being of children. And we know that the school environment and fostering that positive environment is really key to how children do later on in life.
Yes, thank you, Dr. Gina. And my next question was, why do mental health challenges affect more teenagers? Like, is it academic pressure? Is it peer pressure? Or are there other challenges that are taking place in a teenager's mind which make them more susceptible to experiencing these mental health issues?
That's a really good question. I mean, adolescence and stress in adolescence is a whole talk in itself, but I will give you a brief overview and hopefully try and answer some of the points that you raised. So we know that the brain develops throughout adolescence. So by the time you're age 6, your brain is 95% of the adult size. But it doesn't start working as an adult brain until you get to adolescence. And this process of transitioning from a child brain to an adult brain starts in adolescence, but it actually continues until your mid-20s. Yeah. And what happens at this time is that your brain goes through a process of remodeling. So this is where those connections that you don't need anymore, that you needed when you were a child, those are broken away, they're pruned away. And new connections that you need for when you're an adult, those are strengthened. And this remodeling process actually starts in the back of the brain, and it works its way forward over years. And so because of this, teenagers actually rely on the amygdala. So the amygdala is a structure in the brain which is kind of in the middle of the brain and a bit behind, posterior towards the back of the brain. And the amygdala actually is the rational part of the brain, yeah? So it controls things like aggression, fear, anxiety, and adolescents actually rely on this part of the brain to make a lot of their decisions. As adults, we actually rely on the prefrontal cortex, which is at the front of the brain, but that's still very immature in adolescence. And the prefrontal cortex is actually the rational part of our brain. So that's the part that's responsible for things like prioritizing, planning, organizing. So because that's still being remodeled and not mature yet, teenagers do use the amygdala, and that's really why they make a lot of irrational decisions. So it's not really their fault, it's actually the way that the brain is. And because of that, adolescents are not so good at thinking about long-term consequences. Yeah, it's all about instant gratification, short-term gains. What can I get? What can I get? What can I get? They don't think through what the long-term consequences are. So as adults, when we say, well, didn't you think what was going to happen? Why didn't you think about X, Y, and Z? They just can't. It's not their fault. It's the way that the brain is. But I think, as parents, being aware of that, it can make us a little bit more sympathetic to how difficult things can be for teenagers. So their brains are busy remodeling, yeah, so they've got all of that to deal with. But we also know that during adolescence, you're actually at a higher risk of stress and how you react to stress. Now, when we're stressed, we actually release a hormone called cortisol. Cortisol is really important. We would die if we didn't have cortisol. But in teenagers, what happens is they have much higher levels of cortisol, yeah, which is a stress hormone, and much sustained levels of cortisol. So they don't break it down as quickly as we do as adults. And we know that if you have really high levels of cortisol over a period of time, it can actually affect how the brain functions. Yeah, it can have a negative impact on the remodeling process. It can affect things like being able to rationalize things. It can affect things like planning. It can affect your academic performance, and it heightens things like fear, anxiety, aggression. Yeah, so you've got teenagers and their brains are busy remodeling. We know that they're more susceptible to stress hormone. And then you have to think about all of the other things that are happening to them as well. They're going through a lot of changes. They're also at that time in the age where they want to push boundaries. So all of those things together can actually put them at an increased risk of mental health disease. And we know that a lot of mental health disorders that we see in adults, a lot of it first started during adolescence. So 80% of mental health disorders actually first start in adolescence. So the brain really is very susceptible at that time. And it doesn't mean that if a teenager is stressed, they're going to have a mental health disorder. You know, it doesn't work like that at all. But if you take a child that maybe is genetically predisposed to mental health disorders, if they're in a very negative environment, or they have a lot of risk factors that are going to increase their risk of a mental health disorder, and then they have a lot of stress in their lives for whatever reason, you're really, really, really increasing their risk of developing a mental health disorder. And as I said before, you know, mental health illness in adults really can have long-term negative impacts on them. So lots and lots of things to happen when you're an adolescent. You've got all of that to look forward to, Nysa.
Thank you. Thank you for sharing that with all our viewers. I found that those points were very interesting and useful as well. But my next question is to Bipasha. So what are the strategies that EtonHouse is employing to support children's mental health, especially during this past year?
Thank you, Nysa. I think that's an excellent question, and you know for a fact that schools have an important role to play in supporting children's well-being. And Dr. Dahel mentioned it earlier, as well as for a fact that you do spend a lot of time in school, and this is where you form relationships and build trust with peers and adults. So our schools appreciate and embrace this responsibility. Some of our campuses, like our Middleton schools and EtonHouse at Thompson, have collaborated directly with the Contentment Foundation in the US to build sustainable well-being practices for staff and students. We are, in fact, the mothership school, not just in Singapore, but also in Southeast Asia, and the first to formalize this connection with the Contentment Foundation. And in fact, it's interesting that we started talking to them and incorporating mindfulness into our curriculum even before the pandemic. The Contentment Foundation, just to give you a little bit of background and why we value this relationship and this collaboration, is that it's a US-based well-being curriculum and program that provides scientifically evidenced as well as philosophically grounded practices and promotes safe, loving and healthy school environments through 4 pillars, which include mindfulness, community, self-curiosity, and contentment and balance. So it's interesting that it actually incorporates these aspects into the curriculum, and it's not just something that's left to chance. So it's very intentional, very strategic, and it's part of what's being offered to students as well as staff, as well as the entire community. And as Dr. Dahel mentioned, that it's not isolated to the child, it's the entire context of the family that's part of this whole process. If you'd like to read up more about them, you can check them out on their website or also on ours. There's plenty of information available as to how it helps students and schools in particular. So other than these collaborations that pave the way for more long-term, intentional and sustainable best practice in well-being and mindfulness, we have, especially over the last year, introduced more initiatives that address staff well-being. And things like a cuppa and a chat as regular check-ins with staff, something called mindfulness jars, which I find quite interesting. Also recruiting and training more counselors and teachers to support well-being in our schools. Our leadership teams, I know for a fact, are constantly upskilling themselves on mindfulness practice. So this is over and above the curriculum sort of content and practices that they are getting, they are engaging with. This is an expectation that the school has on them in order to lead the process for the entire community. So staff well-being is very important because without staff well-being, you are not able to provide student well-being, right? And also explicit vocabulary is taught to describe emotions. I think that's, again, an important aspect of how we deliver mindfulness. And children are equipped to communicate this, sometimes writing, as Dr. Dahel mentioned, in terms of, it could be letters to our emotions, or maybe even identifying what our emotions sound like. So students undergo a lot of explicit teaching around expressing themselves. Last year, I know for a fact that we provide individualized support to families who've been affected by challenging circumstances as a result of the pandemic. We've had a few families that have unfortunately been affected by it. So, providing individualized support to these families has been what we've been offering over the last year. Other than that, I think simple practices like starting your day with meditation, mindful breathing, also regular workshops such as this, but also school based workshops for students, staff, and parents with intentionality to support what has been an extremely difficult year for everyone. So these are just some of the initiatives that our schools follow. But Nysa, I know you are part of our school community. So would you like to share about how you think your school has supported you and your friends over the last year and also before that in order to manage stress?
Thank you, Vipasha. Yes, I would. So over the years that I have been with EtonHouse, starting from EtonHouse Broderick to EtonHouse Orchard, the schools have hosted a couple of talking sessions with the students. And I find that this has really helped me not only to progress in school, but outside of school as well. Starting with my primary years at EtonHouse Project, they did these sharings on physical changes that happen to us as we are growing older and how we can mentally prepare ourselves for these big situations in our lives. And, transitioning to my secondary years at EtonHouse Orchard, they did these meaningful sharings on bullying and more. And here at EtonHouse Orchard, they also offer counseling to the students who need it. And over the 4 terms of my first year in secondary, I have seen a couple of my friends go for these counseling sessions. And I find that this has really helped them because the way one person behaves in a classroom can also affect everyone else's approach to learning as well. But apart from all of this, I personally believe that children and teenagers should learn how to deal with stress from a young age. So I will be just sharing a few of my coping mechanisms of how I deal with stress. So my first one is to just talk it out with someone, whether it's your mom, your dad, your sibling, or just someone close to you. You should just talk it out with them. I find that when I talk it out with someone, the other person is able to give me a fresher and newer perspective of what I would be going through. And I find that this really helps. Now, my next one is to just take a break, focus on what you love to do. So, if I love to do art, or if I love to do reading, or if I love to dance, I should just do it because I think that this initially helps you to take time to gather your thoughts so that it's easier for you to get back to work. And yeah, and now my final approach is journaling. Now, I understand that this might not work for everyone, but it certainly works for me. So even if it's for 5 minutes at night, you should just write down the highlights of your day, like what went well for you, how you could have worked on yourself better, or how you could have dealt with such a situation for next time. I also find that this really helps you not only to become a better person for yourself, but for everyone around you as well, like your friends, your family, my teachers at school. And yes, yeah, these are my three coping mechanisms.
Those are great coping strategies, I have to say. And Vipasha, it's so encouraging to hear about all of these initiatives. I think it's amazing that EtonHouse is really kind of, being a front runner in implementing all of these things. And Nysa, going back to your journaling, I love journaling as well. I've actually kept a journal every year since I was 14. And, now that I'm a little bit older, it really helps actually to go back to those challenging times in my life and have a look at my journals and see how I coped with those challenging times. And actually that gives me strength to get over things I'm dealing with now. So I think that's a really good thing to do as well.
I'm really glad to hear that.
And thank you so much. I mean, Nysa, I think I'm going to take a few tips off your book because it's brilliant. The fact that you have been able to not just do it, but you are also articulating it for the benefit of other students. So thank you so much for sharing. And before we go on to the next round of questions that came in while from our audience during the registration process, I think it's time for a quick poll since we are talking about support provided in school as well as by parents. So if you could, the poll's already up in front of you. So if you could just share your response, we will have it up for the next couple of seconds. So in what ways does your child's school support your mental and emotional well-being? Okay, it looks like most schools are providing mindfulness in its program, as well as hosting workshops on the topic of mental health, which is extremely heartening. Yeah, I think we can close it now. Thank you for that feedback. Polls are also good, kind of tells us that you're listening in. You're still tuned into what we're saying because we've been talking now for almost 45 minutes. So brilliant. Thank you so much. I'm going to stop sharing. Okay, we're going to share the results. Right. So hosting workshops on the topic of mental health, that seems to be the most sort of popular way of talking about or supporting children's mental and emotional well-being, and I'm hoping that it's helping. So we'll continue to do that, and hopefully other schools will do as well. So we're going to close the poll now. Okay, so moving on to the questions that we received. We received in the last couple of weeks while we opened up the registrations for this webinar. So the first question that I'd like Dr. Gina to address is how can I tell if my child is unhappy, and what can I do to help my child to share with me about how they are feeling? Because very often children don't talk, especially teenagers. So how do you get them to open up?
So I think for that question, it's a really good question. It's something that we get asked all of the time. But it kind of goes back to, it's really unlikely that your child will come up to you and say, I'm not feeling great, I'm not feeling happy. Some children do, they can articulate themselves very well. But the vast majority, just like adults, they won't. So you do have to try and pick it up through other ways. So exactly as I said before, it may manifest through them physically. So there may be changes, marked changes in their sleeping patterns, in their eating patterns. There may be physical manifestations of their symptoms, which we call somatization, as I said before. Common ones being tummy pain, being headaches in younger kids, but they can present in a wide variety. I remember a few years ago when I was back in the UK, when I was on call one weekend in the hospital. It was a Saturday, and I had this 13-year-old girl come in, and they called me to the emergency department because she woke up and she couldn't move her legs. So obviously, as I go and see her, I'm thinking, gosh, is this some sort of tumor? You know, why can't she move her legs? Is there a mass on her spine? And we did so many investigations. We did lots of imaging. We did lumbar punctures where we take a little bit of fluid from the spine. We did lots of blood tests, and actually everything was completely fine. So there wasn't a medical cause for this at all. And actually, speaking to her over a few days, there's actually quite a few things that had happened. And actually, she was just really, really stressed and really, really anxious. And it manifested in her, literally, she was paralyzed with that anxiety, with that fear. And then once we know that there's not a medical cause, unfortunately, it's not a case of saying, oh, you're absolutely fine, you can start walking now. It took her weeks and weeks to get better. You know, she couldn't go to school for those weeks. She had to have a lot of rehabilitation. She had to have a lot of physiotherapy support. So it was hugely debilitating, not just for her, but for her family as well. You know, her mom couldn't go to work for weeks and weeks because she had to stay at home and care for her. She obviously missed out on a lot of schooling as well, so she had a lot of catching up to do. So yes, really looking out for those physical manifestations. And as pediatricians, we're always thinking not just about physical causes when kids come in to see us, but we're always thinking in the back of our mind, could there be a mental element to this as well? So physically, and then through their behavior, as I said, that does depend on the age of the child. For younger kids, there may be regression in their behavior, more anxiety about being separated, not wanting to see their friends. And then for older kids, really kind of breaking boundaries, breaking the rules, becoming more aggressive, those sorts of things. And then also school, their performance at school is a really key one. Suddenly a child that's doing really well, their grades are starting to drop. So it really is important that if you are worried, you do have a discussion with the school. And we always do recommend that, speak to the school teachers. If they notice anything, is there anything that they're worried about? And if it's yes, then it does make it much more likely that there is something going on. And then getting your child to talk to you, that can be a difficult one. Teenagers, they're not great at communicating because actually the communication part of their brain is busy being remodeled. So it can be difficult to get them to open up to you. And what I will say about this is that you have to find someone that they can confide in, and that may not be the parent. It may be a coach, it might be someone at school, but it needs to be somebody. And as parents, we shouldn't feel bad if our child doesn't want to come up and open up to us. As long as they're confiding in someone that we trust, that is just as important. But really, it's about kind of creating that open and supportive environment. You want your child to be able to feel that they can come up to you and tell you anything without the fear of repercussions. Yeah. So for teenagers, particularly, they do make mistakes. And we have to accept that, and we have to let our kids make mistakes. That's how they learn. If we mollycoddle them too much, it's really going to make things much harder when they're older and they do start making mistakes for the first time. So really kind of fostering that open environment where your child feels safe, that they can come up to you. For younger kids, and some kids are really good at talking about how they feel. Some kids love sharing. My eldest daughter loves to talk about how she's feeling all of the time. But, there are some kids and they don't want to talk. They don't want to tell you how their day went. They don't want to tell you how they're feeling. But it's good to start opening up that sort of process. So what I would recommend for those sorts of children is having a set one-on-one time each week. It doesn't have to be with the same parent each time. You can alternate, where it's just you and the child, and you're just doing something that they like to do. And you can ask them questions and they may not want to talk to you. They may not say anything, even if you ask them how they're feeling, you might not get anything. But as you continue to do that over weeks and weeks, what you're demonstrating to your child is that this is a safe space. And hopefully in time, then they will be able to articulate how they're feeling or if they're worried about something. If your child isn't great at talking, and if they're younger, then what you can do is you can sometimes show them faces, smiley faces, sad faces, another way of articulating how they're feeling, their emotions, and they don't have to say anything. They can just show you how they're feeling for that day, and that can be a starting point for you to start discussing with them. And if they're not great at talking and they're not great at expressing themselves, then, writing it down is another way as well. Writing it down on a piece of paper and then giving it to mum and dad about how they're feeling. And that opens up a talking point, and you can start from there.
Thank you. Those are very useful. In fact, speaking from personal experience, having a teenager in the house, to share an anecdote, a particular sort of situation that we overcame as a family. So before every exam, there were complaints about stomachache and headaches. And then we realized that this was a pattern. And obviously the conversations were not really leading to the articulation of what was actually going on. So there was, so I therefore made an sort of a specific sort of thought of a specific strategy as to how to get him to open up. And so I know he likes to play basketball. So I started playing basketball with him. And that's when you start, when you're having these sort of very spontaneous, open-ended, whereas very qualitative interactions with your teenager, there are opportunities for them to open up. And so how basketball stresses him out and how he feels before a game, for example, and what are those stresses and how that translates into an exam environment. So that's where we started to really unpack what was going on, and it helped. I think it did, because the exam results are out and I think he's done okay. But yeah, I remember this particular incident because very often this was coming up. I have a stomach ache or I have a headache, and very often it was just before an exam or an important exam. So yeah, I just wanted to share that. So it's really important to have those conversations, and sometimes conversations with how you're feeling will not elicit the right response. So you have to give it time. You have to have opportunities which are qualitative and really intentional, where there are no expectations for responses, but you're just spending good quality time. And that's when you start to really unpack feelings. So yeah, just a tip from a mother of a teenager there.
Yeah, I mean, that's a great example. And you're right, sometimes those direct questions aren't going to work. You kind of have to come around it, thinking a little bit laterally or indirectly. But just to the point of the stomach pains and the headaches, it's important to note that they actually do have those symptoms, just in case I wasn't very clear earlier on, that it does manifest. So the child will get the headaches, they will get the tummy pains, or that child that I was talking about actually wasn't able to walk, and they're not faking it. Those are real symptoms, and that's the body trying to show them that something's going on and something's not great. But it's only when you actually get to the underlying issue that those symptoms start to get better.
Yep. Right. Moving on to the next question. What are the mental health determinants? This came in from one of the viewers.
Okay, so another great question. This is an interesting question. Mental health is very complicated. So we know that some people are genetically predisposed, and then also there are environmental factors as well. So it is nature versus nurture. Yeah, so it doesn't mean that if you're genetically predisposed, then you're definitely going to have a mental health illness or mental health disorder. If you take a child that genetically is predisposed, but they're in a very positive environment, it's very unlikely they'll ever have an issue. And then the opposite to that is if you take a child that doesn't have that genetic predisposition, but actually they're in a really negative environment, they have a lot of risk factors, then yes, that does increase their risk of having mental health disorder. So none of these determinants are insurmountable, and there are always things that we can do to kind of combat those. So we have the kind of genetic predisposition, and then we have the environmental factors, as I said. So sort of positive determinants, or things that can prevent you from developing mental health illness, are through physical factors and emotional factors. So physical factors are things like making sure your child is really healthy, through all of those things I've mentioned before: good diet, exercising, having the freedom to explore, having the freedom to play. Not something that we worry too much about in Singapore, but of course, as we know, currently there are plenty of countries around the world that, where kids don't have that freedom, and that absolutely will impact them. And then also being in a really positive environment, not just at home, but in school, and a positive community as well. Yeah, so those are the physical factors that can help protect against mental health illnesses. And then the emotional factors are things like being loved, being in a position where they're able to learn, being able to accept who they are, and being able to accept that they're good at some things but not at other things. And that can be a tricky one. So we do see a lot of kids that have mental health issues, when they're older adolescents, because they are different, but they haven't been accepted by their family or their friends, and that has such a big impact on them, a really, really big impact, and it really can increase their risk of mental health issues. And then the sort of negative environmental factors that we see that can increase your risk of mental health illnesses are things like violence in the family, a strong family history of mental health disease, in your parents or siblings, being in a low socioeconomic status, that could increase your risk. Having poor physical health, so if you have a chronic disease, as I said right at the start, if you haven't got good physical health, then that definitely will impact your mental health as well. Having responsibilities above and beyond what's expected of your age, so having being forced to work at a young age, being a carer for your parents because they've got things going on can be really harmful as well. And then not having that support, so being in a school that doesn't have that nurturing, positive environment where things are quite negative, bullying, all of those sorts of things. So those are the kind of determinants. And some of those negative determinants we can't do anything about. You know, if a child's got chronic disease, you can't do anything about that. But really making sure that everything else around them is positive, really focusing on those positive physical factors and emotional factors really can then reduce that risk of developing mental health illness.
Thank you for that. Okay, moving on to the next question. How do you know it's just a phase or one that'll endure for long? I think that's a very, very important question.
So the only way to really know is retrospectively, you know, after time has passed and you look back and you think, gosh, that wasn't just a phase, it's been going on for a long time. So that's a really difficult one to know. But generally, if it's something that's just a phase, you know, your child will bounce back. You know, we all have those days, those weeks where things do get to us when we are feeling very negative. But if we've got that positive mindset, we will bounce back very quickly. You know, we'll start again, we'll try again, we'll brush it off. But if it's something that's longer, you don't see that bounce back, yeah? And also, if it's something that's longer, that's when you start seeing it impacting their day-to-day life, you know? So if it's really starting to impact their relationships, if it's really impacting the ability to go to school and do well at school, if it's really affecting their day-to-day interactions, how the family's interacting, then I would say that it's definitely something that's worth looking into and getting some help for. And even if it is something that's just a phase and they get better quickly, you know, I wouldn't let that put you off getting help. As I said before, early intervention is key. So early identification is key.
Right. Moving on to the next question. How do I support my child to get a good night's rest? Because we understand sleep is extremely important across the different age levels. So how do I support my child to ensure that they sleep well?
So sleep is really, really important. It's my favorite thing to talk about when kids come in and things aren't going so great. But first of all, I think the important thing is to find out what exactly is happening with their sleep, because it can be all sorts of things. It might be that they're just not going to sleep on time. It could be that they're going to sleep, but actually they're so stressed and anxious about things. They're spending 2 or 3 hours thinking about these things. So obviously the approach for that would be different. And it could be, you know, for the younger kids that they're going to sleep, but actually they're really anxious, they're really fearful. They're getting nightmares or they're getting night terrors. And sometimes, you know, kids do have a very vivid imagination, which feeds into them, and they're scared about going to sleep. So it's really important to try and work out what the sleep issue is. Once you've done that, then there are a few things that you can do. It's important that kids have really good sleep hygiene. And when we talk about sleep hygiene, it's about having a consistent bedtime routine every single day. So the routine needs to be the same, obviously depending on the age of the child. And try and aim for them to go to sleep at the same time each day if you can, following the same routine. No screen times for the hour before bed. This is a really important one. I mean, I could talk about screen time all day, to be honest. It's a really important topic, but definitely in that 1 hour before bed, because we know lots of studies show that the light from the screens, the blue light, actually inhibits release of melatonin. Melatonin is a sleep hormone. So it really causes a delay in that being excreted in the body. So that really impacts sleep as well. And actually a lot of kids that we see, once we do implement that and say, make sure there's no screen time in that hour before bed, and that's for teens as well that are sitting in their bed with their phones. You know, you're not letting your brain unwind, so you're not going to go to sleep, and then you go to sleep later and later. And sleep is really, really crucial. But also for teenagers, it's important to remember that naturally their melatonin levels do peak a lot later on in the night. So naturally they'll go from wanting to sleep early to sleeping in later, going to bed later, sorry, and then waking up much later. And that's a normal transition that we see during adolescence. So yeah, trying to work out exactly what the issue is, and then the things that you can do to promote good sleep hygiene.
Yes, thank you, Dr. Gina. And actually, I can relate to this because coming from a teenage student, like a day before an exam, it's really hard to get an efficient amount of sleep because all these thoughts just rush through your head, like, am I gonna do well? What will come for the test? And it's just it does get really stressful. And knowing my coping strategies that I can use, that really helps me a lot. And now knowing how much more important getting a good night's sleep is, I feel that that will also really help me as well.
Good.
Thank you for sharing that, Nisa. For us, it was a family agreement. We actually write it down. So there are discussions about when the sleep time is appropriate, and during school time, during term time, and during holidays. So it's a shared agreement. So if there are discussions around how to move it or move it to a later time, there has to be a good reason behind it. So that's again from a parent's point of view how we address this with our teenagers. So right. So I think unfortunately that's all the time we have. That's all the time we have for this session. I know some of you sent me questions while we were having this discussion, and apologies that we couldn't get to your questions. We also received quite a few questions in the run up to this webinar, and unfortunately, again, we were not able to share it today, the responses to your questions. But what we can do is we can try and respond to the questions after. So we'll try and put all of this content together into an ebook or an article and share it with you. So hopefully that'll help. A huge thank you to Dr. Gina Dahel for that generous and insightful sharing. That was absolutely brilliant. And a big round of applause for your youngest, most prolific co-host. Thank you, Nysa. That was very well done. Very, very well
Thank you
done.
so much.
And of course, thank you to the viewers. Thank you ever so much for joining us today, and for every other parenting webinar that we have. And thanks for giving us your lunch hour. We will have the recording sent to you on email. So if you haven't been able to participate in the live session, you could listen to it later or even share it with your friends. We also have loads of information in our parenting section. And apologies for the plug, but it's parenting.etonhouse.edu.sg if you want to access our ebooks, guides, podcasts, etc. on all things parenting. Thank you once again for joining us, and we will see you at our next webinar. Till then, take care, stay safe, and happy parenting, and always enjoy your children. Thank you, and bye-bye.